Hello, I'm Adnan Tufel. I'm a clinician working at Moorfields Eye Hospital and the Institute of Ophthalmology, University College London. And the project I'd like to interest you in is a project looking at the commonest cause of legal blindness in the working age population, that's diabetic eye disease. And diabetes can cause damage in the retina, the light-sensitive part of the back of the eye, and it can cause this in a number of ways. And although we have a reasonable understanding as to how we can treat and prevent this, we don't fully understand how the eye disease is related to disease activity in other parts of the body, such as the heart and the kidney. We've already done some very interesting work looking at large eye datasets. In fact, we've already published on the largest eye datasets in the world. And this has caused tremendous interest both in Britain and America and from health economists looking at these data in novel ways of modelling the disease and treatment of this disease. And using and building on what we've done to date, we'd like to not only look at these large eye datasets, but also merge it with imaging on the individual patients longitudinally and look at novel methods of looking at this and link it to datasets for looking at their kidney function and heart function. So this will be a unique opportunity to build some novel methodology on already the largest data sets on eye disease in the world. I've described the clinical problem, and Paul Taylor, my colleague, will now describe the technical aspects of the project.
I'm Paul Taylor. I'm a reader in health informatics, and I'm based in a new entity at UCL, which is the Institute for Health Informatics. One of the things which is creating enormous excitement at the moment is this idea of big data. And UCL is becoming one of the leading centres for doing research in big data in healthcare. And this project is going to do exactly that. We've got access, as Adnan said, to a very large database of images, and we're going to analyse those in ways which are going to be challenging in three different ways. The first of those is the registration problem. So what we're interested in is looking at change. So we're going to analyse temporal sequences of images, and that's going to involve differentiating between the normal variation which you'd expect to see across a sequence of images with some special cause variation which tells us something about the disease. One of the other challenges is going to be finding some numerical measure for things which the clinicians see on the image. Very often a clinician will look at an image and have some intuitive idea that there's something going on, and they'll describe it using terms like tortuosity. They'll talk about the twistedness of the vessels. Well, the interesting question for us is how can we find a mathematical definition of tortuosity so we can compare it across different images. And the third aspect of the project, which I think is going to be particularly challenging, is looking at data visualization. So we're looking at very large and complicated data sets, and we need to be able to abstract information from them and present it to clinicians in a way which helps them inform their ideas about their research. And I think that's going to be really interesting. UCL is a really great place to do this kind of work because it combines strength in epidemiology and statistics and this kind of population-based research with very strong computer science, but also it has incredible clinical connections. So we're working not just with the guys at Moorfields, but also with people at the National Institute for Cardiac Outcomes Research who've got access to all the other data we need about the diseases.